So thank you for giving me this opportunity to talk to you. I'm going to talk to you a little bit about the standards, but I'm also going to be importantly talking to you about what we're going to be doing and actually launching this week. So you need to keep an eye on your emails and to see how you can get involved. So this is something that you are all familiar with. We've had some high-profile theme reports come out in England, particularly, and if you spent some time looking at all of this, you can see there are definitely some common themes between all of them. So in Ockenden, that report talks about women and families not being listened to and their concerns not being addressed. Talks about the lack of compassion by their caregivers and poor working relationships between those teams. Kirkup says something similar about failure to listen to women and their families. Again, lack of kindness and compassion, failure of team working, and in some instances, disrespect. And I'm not pretending this is an easy listen, because it's been a very difficult period in time, hasn't it, when we have to actually address what these are saying. But we've also had some other key reports, which interestingly both came out in 2022. So there was the 5 times more report, which I know Rebecca was alluding to this morning. But those reports are saying the same thing, that there are harmful and disturbing attitudes within the maternity services, concerns not being addressed, spoken to in a dismissive way, being ignored, being coerced, a lack of informed consent when care is being given, racism and discrimination, and lack of interpretation services. Birthrights also did a report last year called Systematic Racism, Not Broken Bodies. And again, you can see same phrases being used, that women describe being ignored, disbelieved, racism by the caregivers, not given a proper choice or means to give true informed consent, and subject to coercion from caregivers. So it's no coincidence, is it, that all these seem to say the same. This must be happening. So what do our standards say? Because in fact, a lot of this is around communication, isn't it, and how we work with women and families. So we talk about the fact that midwives should use effective, authentic and meaningful communication skills and strategies with women, newborn infants, partners, families and with colleagues. And that we must develop and maintain trusting, respectful, kind and compassionate, person-centred relationships with women, their partners and with colleagues. And I can remember at the time us thinking about those standards and thinking, do we really have to say kind? But when you see what's in the reports, that word kind actually needs to be there. And you know, it makes me feel very uncomfortable. And I think we must remember this isn't talking just about midwives, is it? This is talking right across the board, multi-professional colleagues. And I'm not suggesting anybody in this room would, but somehow it has to be caught out, doesn't it? And then 1.13, demonstrate the ability to always work in partnership with women, basing care on women's needs, views, preferences and decisions, and working to strengthen women's own capabilities to care for themselves and their newborn infant. And of course, we know that and I'm hearing this a lot, about what do you do when women are asking for things, which the term is used outside of guidance. And I remind midwives that women don't actually have to follow guidance. Guidance is something that is developed, to maintain good practice, but women don't follow guidance. And the important thing is we recognise that women do have different needs, different views from probably our own, different preferences, and they will make perhaps decisions which we may think is not particularly unwise, but it is their decision nonetheless. And it's challenging and it's difficult, but this is all around communication and, of course, our role as midwives to ensure that the women have all the information they need to base their decision. And they may decide to do something different, but the communication must continue nonetheless. And we go on. We say quite a lot about communication in the proficiencies, that we must demonstrate the skills of advocacy and leadership, collaborating with and challenging colleagues are necessary, and knowing when and how to escalate concerns. I think the challenging colleagues is probably one of the most difficult things, particularly if they're perhaps more senior or in leadership positions. And we must demonstrate the ability to advocate for women and newborn infants who are made vulnerable by their physical, psychological, social and cultural or spiritual circumstances. So we're thinking about perhaps women who are new to this country, perhaps a migrant or seeking refugee status, or perhaps women who don't speak English as their first language, or perhaps they are vulnerable for other reasons. And we go on. So I suppose what I'm trying to demonstrate about these proficiencies is the tools are there for you to use these proficiencies when you're facing some of these challenges. And sometimes using a proficiency, particularly if you need to challenge or you need to address maybe parts of the service, can be really important. So what does this one say? This talks about explaining the rationale that influences your judgments and decisions, so that you are actually able to talk through with women and colleagues about why you're suggesting the care. And then 1.19 talks about that we should all be courageous, we should have integrity, we should be transparent and have a professional duty of candour. So where things don't go right, and that we actually own up to these mistakes. Particularly where care has been substandard or there has been dysfunctional attitudes and behaviour, ineffective team working, and there's been an adverse outcome. So I suppose what I'm saying is that we've no doubt that our standards can be held up to scrutiny. When these key reports come in, we map our standards, we go back to the standards to say, do they still meet what we need to, do they still say what they need to say? We can't just change standards because that has to be a consultation process. But interestingly, when you pick out these standards, we've done it for the Ockenden report, we've done it through the other reports, you can see how they actually still do stand up. So, we recognise, of course, that there is a lot that does affect communication. Context and acuity within the service, when you're tired, when a midwife is hungry or thirsty, the knowledge base that you might have, as well as the individual woman's circumstances and the requests they're making. And of course, importantly, we also know that relationships and communication can be impaired when perhaps it isn't the best with your colleagues and there isn't team working. And just going back to that first bullet point about context, and I've said to a few of you today, a tiny proportion of midwives ever get referred to us for fitness to practice, and an even tinier proportion go through the process. But whenever anybody is actually referred to us, context is something that we now look at. What was actually happening when that occurred? And it doesn't mean to say that the mistake didn't occur, but what impacted or maybe influenced or affected that professional's ability to work because there was something happening within the service at that time. So what are we doing to support you? Well, hopefully you can see by those examples I've given you that these standards are for all of you. They're not just for students on programmes, they're for all of you in your practice. And I know I've been having conversations today about how you can use these standards to support your revalidation. But use them as well to influence how your practice is developed and also how the service is developed. We've also produced resources to encourage partnership relation building, listening to women, their partners and families, and we also have got a number of case studies which could be useful. And as I said, the important thing is that you can use these resources as part of your next revalidation. And this week, we are actually launching these campaigns for the public and midwives. So for midwives, what we want to do, because there's too many gloomy stories, and we really want to actually raise awareness of how good examples of ways of midwives are working can be celebrated. So our comms team have put together some of this, so they'll be in the public domain, showing how midwives make a difference in the care they provide to women, babies, and listening and acting on women's choices and preference. And the reason they should be useful, that if this is something you're struggling with, then why not look at how somebody else is doing it? Because they may have a good idea that you can quickly adopt rather than reinventing the wheel. So we want to showcase how our standards can support this to be achieved, and we want to show how midwives and women working together will really make a difference to deliver the best care. But it's important because obviously one of our roles is protection of the public, that we do something for the public as well. Because of course the public read the media and there's not a lot of good stories. They don't tend to sell newspapers. So it's important as a regulator that we actually worked, that the women also and the public also see this. So again, focusing on the partnership between women and midwives in the antenatal period. I think they've just chosen that period, not saying that doesn't happen all the way through, but that's the particular focus they've had, because that then builds women's confidence as they move through their maternity journey. And the aim to increase women's understanding of what they can expect from their midwife and how they can make decisions about their care in partnership with them. And of course, I think before when I've spoken at these conferences, I've also showed you the animation that we've still got, which actually still talks about that. So you can show that to women in antenatal clinic or give them the link or in parent education or whatever. Thank you.